Hey everyone, my name is Dr. Shayna Powell. I'm a naturopathic doctor in the state of Colorado and owner of West Elks Wellness. This morning, we're going to be talking with a birth advocate, birth sovereignty advocate, and a doula, Eyla, and I'll have her introduce herself. And we're gonna continue with these more free flow conversations as opposed to kind of uh, outline. And so I'll have Eyla introduce herself.
Hey, Shayna, thanks for having me. I'm excited to be here. My name is Eyla Cuenca. I am a doula, childbirth educator, birth trauma alchemist, and a mother. And I'm in the sunny state of Florida.
So, what exactly is a doula? Because I know there's lots of different types of doulas, and if you could just share with our guests, like what exactly that means.
Yeah, so I mean, at the most basic level, a doula is really a physical and emotional support person through
Mhm.
a transitional process. So whether the woman is, conceiving and wanting support and holding through that process, or she's grieving loss, through miscarriage, or she's actually birthing, or she's in her postpartum phase, a doula is trained or should be trained and well versed in supporting and holding space for that process. Um, so yeah, that's at the most basic level, and then of course we have doulas who specialize in certain
Right.
nuances around the whole process.
I know like advocacy is something that's really important. So like for example, I was just at a herbal festival this past weekend and one of the ladies was sharing a story about one of her clients as a doula who really did not want this surgeon. If she needed to have a C-section, she really just didn't want this one surgeon. And she was so tired after the labor and ended up needing a C-section, and the doula and the birthing the mom decided, or the mom was like, yeah, just whatever. And the dad was like, no. Dad and the doula both advocated for mom to say, hey, like, we need a different surgeon. My wife
Sure.
is tired. Like, and so that's kind of that advocacy pit as well, right?
Yeah. Yeah. And so doulas, if they have that background in being trained in understanding interventions, then
Mhm.
they're able to really like advocate in that sense. It's tricky in a hospital setting because a doula really isn't there to stand between the system and the family and, bridge that gap. She's there
Yeah.
to empower the mother to remember, to come back to her intuition, to come back to her instincts, explain, risk and benefit to her, more privately, and then the woman should come to her own conclusions. And so, that's where there's a lot of doulas who've splintered depending on the type of training they had, where they will say, well, we're going to support her through this high intervention birth because we want her to just have a cohesive experience with the hospital. And we, even though it was her desire and her wish to avoid that surgeon, for example, we just want it to be smooth and easy this point forward. So I'm going to just say, this is a good idea to work with this surgeon. So there's doulas who I feel like end up kind of working more for the system rather than reminding the mother and empowering her to stay,
Mhm.
with 2 feet on the ground. So
Yeah.
yeah, there's an advocacy piece and it gets a little muddled sometimes.
For sure, and, like, in that situation, it's not like advocating or, giving medical advice. It's like, "Hey, we talked about
No.
this as part of our birth plan," and to reduce some of those traumatic experiences that so many women have going through pregnancy, and I feel like that's a lot of reason why women get into being a doula in the first place is they had an experience that was negative, and they are like, "Hey, let's not have this happen again. Like, I've alchemized my experience, but I wanna make sure that another woman doesn't have to have that same experience either."
Absolutely. I mean, women doulas should never give medical advice. They just should point the woman in the direction of resources. And the goal should always be that the woman becomes radically responsible for her choices. And she should never hold the medical system accountable, the midwife, the doula, anybody accountable except for herself. And so that's part of what the doula should be offering. And then, of course, many women become doulas, like you said, because they had certain experiences. I lead a doula training. And so a lot of the work we do in doula training is processing some of that stuff
Mhm.
before they come into a position of holding space for women, because you can't give what you don't have. And so if the woman has not alchemized her birth experience, and she's there to kind of like fight the system or to redeem herself through the doula work, that can kind of get complicated and I think bring a certain kind of heavy, prickly energy to the experience for her client, for herself. So it's really the
Totally.
responsibility of the doula to work through that before she comes into a space of holding, for the birth.
Yeah, I really love the radical self-responsibility, radical self-ownership, because it really gives them the power back. It's like, well, no, there's all these intervention options and and it does feel overwhelming. Like I'm due at the end of October and I will tell you, it feels incredibly overwhelming, the amount of things that I need to know in order to make sure that if some X, Y, and Z happens, I am going to make the right choice for myself and my family, right? And
Right.
it feels overwhelming, but I also have the education understanding to know, the pros and cons, the risks and the benefits. C-section rates in most hospitals in the United States are insane, like
Yeah.
33%. That's
Yeah.
off the charts. And WHO, whether, I agree with all of their, stamp of approval marks, says 10% or less is really what's necessary for most women that have C-sections. We're triple that in the United States in most hospitals.
Yeah, I mean, most of Western Europe and Latin America and North America have the highest C-section rates, right? It's
Really?
interesting because the places that tout having the most technology are the places that have the highest C-section rates. So if we have more ways of properly, and I put that in air quotes, properly managing birth and properly managing pregnancy, then why do we have so many women and babies in trouble requiring C-sections, right? And
Right.
so, a lot of what I teach in birth classes to pregnant women, then also to the doulas that I train, is that the more we involve the technology and the interventions, the more we start to rely on that as a barometer for how a woman's process is unfolding. And we always end up defaulting to the high intervention situation, because the more we mess with the natural process, the more it kind of backfires on us, so to speak. And so it's a
Totally.
much more complex than that. However, it is the more underdeveloped countries that have the lowest C-section rates, the highest instance of uh, uninterrupted, normal, natural, physiological birth.
Mhm. And it's trusting that process. And there is a time and place for medical intervention. And I'm grateful I have
Right.
two girlfriends that got preeclampsia and need to have intervention. And had we not been in a place that had access to those, either one of them could have died or both of them could have. And I,
Hmm.
preeclampsia is like something, I don't know if you know very much about it, but we don't really understand why women get it. There's a lot of hypotheses, but there's nothing that's like set in stone as to why. But over intervention has a lot of problems. And it's like, I literally was just talking with someone about this. And when you get a C-section, they cut through your omentum, which is this like fatty, vascularized, nerve-rich tissue that sits kind of covering your abdomen. You're
Hmm.
protecting your visceral organs. And then it also cuts through your abdominal muscles. And if you don't do rehab, I mean, even if you did, you're never going to go back to the way you were, but you need to do that rehab, and that's not emphasized enough. And so now we have women in chronic pain. They don't even realize that they don't need to be in because of the
Right.
intervention.
Right. Yeah. I mean, and then not to mention cutting through the uterus, and
Oh,
then
yes, and definitely the other muscle,
cutting
where the
cutting
baby's
through
at.
the
Yes,
amniotic sac, and then often injuring babies because you don't really have
mm,
a lot of control of where that scalpel's going. And
right.
so we
Oh,
do see a lot of fetal injury during C-section.
oh my God, I
Um,
didn't even think about that.
yeah, yeah, yeah. It's unfortunate, very unfortunate. And it's happening very quickly. And so the
Mhm.
thing about the C-section epidemic is really that the the aftermath is not often explained to women. Right,
Mm,
and so women take it a little bit more casually than I believe they should. Same thing with epidurals, same thing with inductions. The whole picture is not really painted for the woman, but it's also who's painting the picture, right, and the perspective, because someone might say the induction could save your life, and so whatever is attached to that intervention, is kind of negligible because the point is we're saving your life.
right,
And so
exactly.
women don't realize that there's a lot attached to an induction, and the way that it can impact breastfeeding and the way it could even impact postpartum. So we in society, we view birth as this isolated event. We view the pregnancy as, somewhat connected to the birth
Mm,
outcomes somewhat, and then postpartum is kind of this own thing floating by itself, right? And so when we start to understand the whole arc as a web, so the decisions made in the pregnancy, the decisions made in the birth, they're all interdependent on one another. And so
right.
breastfeeding, or the challenge of breastfeeding, postpartum depression, those things are really tightly connected to decisions made in the pregnancy and in the birth. And
Interesting.
so
I was not
it's not
aware.
often.
About the inductions, it's like, again, being an naturopathic doctor, most of my education, although quote unquote alternative, is still very conventional. We have to
Sure,
learn conventional treatments and approaches so
of
that we can
course.
speak that language while we're standing to one foot in alternative medicine, one foot in conventional medicine. And so
Right.
it's still unpacking and unlearning things. And there's definitely some interesting OB-GYNs, I'll say, on social media that have a lot to say about those of us that are practicing a little more alternatively. And you know, um, one gal in particular, while I respect a lot of the opinions that she has, she's very much against, like, you don't need an epidural detox. It's not going to impact the baby. When I found out that they give fentanyl prior to epidurals, but I was like, wow, that's a pretty strong, heavy sedative, or excuse me, heavy opiate medication, 100 times stronger than morphine, in fact.
Yeah, I mean, there is a local anesthetic given in order to get the epidural started, and then
Hmm.
the drip inside of the epidural is fentanyl and lidocaine or bupivacaine. So the
Hmm.
woman is exposed, and the baby, woman and baby are
Hmm.
both exposed to fentanyl sometimes for 12 hours,
Right.
depending on how long she has
Labor.
epidural.
Right.
Yeah, and so we don't realize that, when a woman is in that sedentary position because she's had an epidural, whether it's worked properly or not, because sometimes you just one leg goes numb and the other one, you still feel everything. So
I have
now
heard those
you
stories
just
more commonly than not,
gotta live
unfortunately.
with it. And so it's not explained to her that when she's in that sedentary position, she's in the supine pose or maybe on her side, the
Right.
baby is not being supported in the labor process, right? The baby needs activity. The baby needs the mother to walk around so that it can continue to descend and engage in the pelvis. And so
Mm,
this is why we often see that epidural births require additional assistance like vacuum extraction, where a vacuum is placed on the baby's head and it's suctioned out, or forceps. People say, oh, they don't use forceps anymore, but I've been attending births for over 10 years and they sure do. So, this is often not explained to the woman. It's also not explained that with the epidural, because of the fentanyl, the baby's heart tones can accelerate, decelerate. Baby might not like it, let's say.
whoa.
Obviously,
Yeah.
it's a heavy amount of drugs for an adult, and we've now come to understand the myth that, we've busted the myth that what goes into the cerebral spinal fluid does actually reach the bloodstream and does actually go to the baby. So the
Yeah.
baby is now in this drugged state and they're unable to participate actively in the labor. And so then an
Mm,
emergency C-section gets called because now the labor is either prolonged, failure to progress, or the baby's
mm,
heart tones are not. We don't like the baby's heart tones. And so she has an emergency C-section. And now she believes, well, thankfully I was in the hospital
right.
because they saved my life and they
Right.
saved my baby's life. And this is an instance where it's what I call self-induced. There is nothing. The epidural is a recreational procedure, so to speak. It's not something that makes labor safer. It's not a
Mm,
medication that now suddenly the blood pressure is lowered, right? It's not actually correcting something. It's just a pain relief technique that has a lot of side effects and potential
yeah.
risks. And so when the woman elects to do this, she doesn't realize she's now put herself and her baby in a danger zone of a lot of potentials and most likely will fast track herself to a C-section. So we have to be clear that there are instances for C-sections where they do save lives
Absolutely.
depending on the situation. And that amount of women is much smaller than where we're at now with emergency C-sections. So
Totally.
some of
Or
them are
planned
self-induced
C-sections.
or planned C-sections, right? And so some of
Right.
them are planned and some of them are self-induced and some of them are actually required.
Mhm.
Yeah.
Yeah, kinda backing up a little bit, we're getting a little medical here. With the way that our culture, because you've grown up in the States, I've grown up in the United States, the way that I have seen birth portrayed in books, movies, TV shows, other women talking about it. I mean, my grandma's birth story of my mom was horrendous, and
Mm,
I'm shocked that those are some of the practices, like her being, like, handcuffed to the bed and, like, so
sure.
drugged that she was, like, unable to, like, function, and that was a
Yeah.
common place for babies born in the '50s, apparently,
Mhm.
which is
Mhm.
insane to me.
I
The
have
culture
video footage of that. I've seen it.
is scared, and we're like, "We should be scared of it." It's this really awful, painful, screaming and yelling, bloody mess, and then somehow a baby comes out, and, like, that's not spending time with my midwife or like other people that have done home births or the way that my colleague is describing her free births in her book. She's like, yeah, my second kid wasn't even painful, like compared to my first. And, she had learned some things, and it's a very different world. And I'm sure you see that in the work you do.
Hmm. Yeah, I mean, we all know like the movie Look Who's Talking from when we were kids, where she's in labor, she's screaming in the taxi, and she needs to get to the hospital to get the drugs. And as soon as she gets the drugs, then all is well in the world. And so this is what we grow up seeing as little girls, that we have this thing that we're all, a birthright, which is becoming pregnant. It's our birthright. And then this is how we have to deal with it. We have to just go from pregnancy to having a baby, and that little middle part of giving birth, we have to get through it as quickly as possible. And if we can avoid it or shorten it, we should, right? Because it's just pain and suffering, and pain doesn't
Yeah.
have a purpose. And so this is how it's depicted to all of us, and it just starts to build in the unconscious, and then it even impacts the way men look at birth. And it's like, once we realize pain does have a purpose, right? That every time a woman feels a contraction in labor, signals are sent to the brain, which then causes more hormones to release, which keeps the momentum of labor going. So that's why often when a woman stops feeling contractions because of drugs, her labor will stall, because the body becomes confused, wondering if it's still in labor. And so
Mm-hmm.
the sensations, I like to call them, have a purpose. And when a woman knows how to work with her body, that's why we get women, like you mentioned, who say, it was painless, or I didn't feel it like I felt my first one.
Yeah.
Mobility is one of those things. I'm an anthropology background, and so I have an anthropology background, and so I, studying the way women birthed cross culturally and historically, you see that it was always active. Women were always walking around. Women were moving with each other. Women were not restricted to a 10 by 10 room or an IV. They were not starved either, which is often the case in the hospital setting. And so they had the fuel they needed, and there wasn't a time limit put on their labor. So they didn't feel the pressure to perform if their body was taking, quote, longer than everybody's comfort level could handle.
Right.
And so, yes, there are instances where natural, normal physiological birth does get complicated, but those instances are much more rare than we think. And so, yeah,
Yeah.
it is about reframing the way we view birth and this rite of passage, um, to really start
Mhm.
changing the way women welcome in this situation.
And
Um,
is this something that you go over in your doula training and help doulas help, especially new moms, because I feel like it's different when you've had a kid. It's like, okay, I've had this experience versus I have never done this before. And there's, like I said, it felt a little overwhelming in the beginning, like all the things that needed to be
yeah.
known.
Yeah, this is definitely something we go. I have a doula training, and then I have a birth educator training. So I have two separate trainings for people who just want to teach about this, and then actually women who want to be part of the process and guide and hold space. And so of course, we talk about that. We talk about the cultural warping of childbirth and how our view
Mhm.
of childbirth has changed over the last 150 years because of media and because of, Rockefeller medicine, right? So
Yeah.
this this is this is something that happens to a woman's body that belonged to women. It wasn't actually a health condition that needed to be treated. However, we've taken pregnancy and we've put it into the framework of conditions to be treated. So we're trying to do something that's actually natural and normal, but we put it into an emergent setting. And so it's become quite confusing for a lot of people. Most people, I would say.
Right, right. I would say most people, absolutely. It's like, um, I I have another colleague of mine. She's also in the healthcare system, but conventional trained. And she decided to have her baby in the hospital because of all the complications that could happen. And in my mind, I'm like, I know that those complications happen mostly because you're in the hospital setting and they're trying to, quick, flip the room over so they can get the next patient in, basically. I'm being a
Right.
little crass, but everything is a for profit model in conventional healthcare. And how can we move as many people through as possible? And that's
Right.
part of the Rockefeller picture is like this is what Ayla's mentioning. I've done videos on this before. The Flexner Report of 1910 that Rockefeller and Carnegie worked together on to make any alternative medicine basically considered quackery and pseudoscience. And those are
Mhm.
words they
Yeah.
use specifically to slander other professions. And I know, for example, homeopathic schools were 4-year medical degree programs prior to conventional medicine kind of being referred to as traditional medicine, which is something that really grinds my gears when people say that. No, that is not traditional medicine. It's barely been around 100 plus years. Traditional
Right.
medicine is the herbalists, the midwives, the shamans, the indigenous medicine people that helped support their villages and tribes throughout the eons of time, way before we had surgeons with knives.
Absolutely. I mean, we look at Western Europe, and that's when the physician came into the birth space, when Queen Victoria gave birth. And so that era was when male physicians came into the birth space. They'd, more upper echelon families would be able to have a physician come to their house. The physicians learned about birth through studying cadavers, through studying illustrations of uteri in books. They actually had not, they didn't understand the process, whereas women, midwives, who had passed down these traditions and all of these, let's call them medical teachings, transgenerationally, they had all of that knowledge. So they knew how to treat certain things like postpartum hemorrhage. They knew how to look out for the warning flags that would come along in a woman's labor and then treat it. Right.
Yeah.
They couldn't rely on C-sections. They couldn't rely on these other things. So they had to be able to treat it at the core. And so then this was hijacked. And because, the royal family, for example, in England, they were using chloroform. They started using chloroform for labor. Then that's when it's like, oh, I can kind of check out. And if I'm well to do, I can have a male physician at my house. And so it slowly started to infiltrate the birth space. And then, of course, New York hospitals said, well, how do we, what's happening every single day that we could make money off of? Oh yeah, women giving birth. So let's create this, really beautiful advertisement and, alluring advertisement where women can come, they can get knocked out, and the baby can get, birthed from them. And then they can get taken care of by a nurse, and they could even be fed formula, because then the woman doesn't even have to breastfeed. And so it just started to become very desirable. And it only takes one generation, right, to lose a language, to lose a recipe, to lose the way that we birth. And that's what happened. And so by the 1940s, almost into the 50s, 60% of women at that point were already giving birth in the hospital. And now we're at, 98% of women give birth in hospitals in the US, for example. I know people listening to this are like, no, there's so much more home birth happening, but we are really in a small petri dish of people. We're kind of in an echo chamber. Natural birth, home birth, free birth, those are things that we hear about because maybe we have social media, but they're really not common, and they're not happening everywhere every day.
No, they're not. And both of the midwives in my town, they do say they're having a lot more first-time moms than they've seen in previous years. But again, if we're taking, 50% of the United States as female, and, our birth rates have severely declined in this country, and then we take those that are interested in home births. I mean, my colleague that I mentioned that had conventional background training, she thinks I'm crazy for wanting to do a home water birth. And I'm like, well, seems like the safest option, less likely to have side effects, and that seems like the
Right.
best course of action for me based on my
Sure.
understanding and my experience. And like you mentioned something very beginning, maybe before we started recording, it's like intentionality and how you approach your thought towards the birth process is something that's so, so important.
Yeah, absolutely. I mean, there's two things there, right? How do we define safety? And for this medical model, safety is just not dying,
Hmm.
right? So in my model, safety is a whole host of experiences that keep me safe from physical violation, emotional violation, let's say spiritual violation, for example. So that for me is safety, and being in a setting that is waiting to do a surgery that doesn't feel very safe to me. Right. And so it's about defining safety. And
Hmm.
that's where I would ask women to begin. What does safety mean to you? If it just means staying alive and there's no spectrum there, then that's the hospital setting, because most likely you will stay alive. Right. But
Yeah.
if you want to have a different experience where you're not threatening the health of your baby, you're not threatening your own health, you're safe, you're supported, then that might be a different setting, like a birth center or even home birth. So it's about defining safety. And then, of course, the intentionality. I think free birth, for example, is is something that can happen completely naturally. I've had clients who plan to go to a hospital and their labor happens more quickly than than they thought, and the baby's born in the bathroom or born in the living room and
Right.
everybody's fine, and then they say, well, I guess I don't really need to go to the hospital, and that was great, and hardly
Yeah.
noticed my labor, and there we go, right? So free birth is, free birth.
Yeah.
However,
Free
a lot of
for For people that don't know, free birth is without a medical professional there. And a doula is not considered a medical professional, so you could have a doula and your husband there with you. And these things do happen. It's like we hear about people, their baby being born in a cab on the way to the hospital, right? Like free birth, technically speaking.
Yeah, technically speaking, that's a free wild birth. However, many women who choose free birth, I often find when I'm working with them, they feel dropped by the system. They feel angry with the system. They're scared of the system.
Yeah.
They even, midwives are part of the system, and so they're feeling like a lot of charge, right? And
Mhm.
so they opt for this. But for me, it's kind of like in the same, and it's just like in the same energy, just like a different part of the spectrum. A lot of
Yeah.
these women feel like they've never been supported. They have to take matters into their own hands. They have some issues with their own parents, and so sometimes there's a lot of charge that comes behind that decision of doing a free birth. There's a whole opportunity for healing, because why
Mhm.
should we reject support? We just don't know how to find the right kind of support,
Mm.
you know?
Yeah,
And so
that's a
that's
really
why I
good
do
point.
talk to women who do transfers after a free birth, because the intentionality for the free birth was, for me, kind of muddled. And so, when we
Mm.
process it, they'll say, oh, that person wasn't there for me, and no one's ever there for me. And it's kind of a self-fulfilling prophecy. Not to
Yeah.
say that free births can't be ecstatic and blissful and totally safe. There's just a whole emotional and practical preparation that we have to do. Just because you're birthing with a midwife or doing a free birth doesn't mean that you're exempt from actually learning about this process. And the reason
Right.
it feels so overwhelming and daunting is because we first have to unlearn
Yeah.
everything that we've learned about birth and pregnancy, and then fill the cup with actual useful, empowering information.
Yeah, absolutely. I don't know if any of the clients you've worked with has said this, but the most common question people ask me as a pregnant woman is, "How are you feeling?" And honestly, I feel great. Like I'm, little minor discomforts, but nothing that's like worth having a discussion with a complete
Yeah.
stranger about. And
Yeah.
to me, I find that to be really like again that cultural like, "Oh, if you're pregnant, you're supposed to be this, this, and this." And when
Yeah.
you're not, then it's like then I feel like I'm not quote unquote normal, but actually that is a normal pregnancy experience is like minimal side effects, maybe a little discomfort here and there. Is that been your experience as well?
Yeah, I think people like to, I mean, I don't know how much you've gone into this with your audience, but we really like to use illness or discomfort to define our identity, right? So many
Totally.
people wouldn't know who they are unless they are ill or their diagnosis gives them meaning, actually. And
Yep.
so when a woman is pregnant, it's like some of them are surprised they feel fine, because they're expecting, and so when people say like, "Oh, are you just like so over it? You're so done." And it's like, "Well, no, I actually enjoy this. I feel really good. I feel radiant. I actually feel more energized. I feel more motivated to do things." And it's like,
Mhm.
"Oh, so then maybe some bonding and connection that they would normally have with a friend or with a family member can't be there because there is nothing to gripe about, you know?"
Right.
And so, yeah, it's just very much in our culture to expect that women or people see you when they're really pregnant and they say, "Oh, can't I can't, it looks like you're ready to be done with this. Do you feel
Yeah.
horrible?" It's like leading with that, and
Right.
so,
That
you know
negative see, again, that's that cultural unlearning that we need to do because women have been doing this process since the beginning of time. And
right.
while maternal death rates have improved significantly with the increase in technology, there's also some negative consequences to the technology, as Ayla and I have been chatting.
Yeah.
And I do think that's an important thing for people to know. And I've chatted maybe not extensively about the victim identity of like I see it a lot with people that have like really significant chronic infections or like, Lyme
Right.
disease. I see it a lot with. I have Lyme disease. It's like the way I live. I'm never going to be able to get rid of it. And like, I kind of feel flabbergasted by that because, and some of our shared interests lie in some of these weird pathogens and like they're
Yeah.
can you ever really get rid of them, I guess, is my question. And I don't actually think you can. We have to learn to live in symbiosis with them instead
Right.
of owning the negative
Right.
consequences of all of these things.
Yeah, and it's very clear to me with many of the women that I work with, they want to step out of that model, right? They want to educate themselves so that they can feel empowered, and they want to gravitate towards other women who are excited about the process. And so when she's in that awareness in her pregnancy, she starts to feel kind of lonely because she realizes there's no tribe or community of people who want to feel good, who want to be excited about this rite of passage, who want to be excited about birth. And so
Mhm.
that's why I say there's almost like this, this death that happens within that individual's experience where she says, "Oh, I'm learning that this can feel good and I no longer need to have the victim story. And
Yeah,
so
yeah,
who am I
exactly.
now? And what do I do now?" Right?
Mhm.
And
Right.
many of us want to be taken care of. And sometimes the only way we can get taken care of as children is when we're sick, right? And so what happens when we become pregnant? It's like the only time I get attention from family or, the parentification of the medical system, the only time I'm going to feel taken care of and feel held is if I have some sort of condition or complaint. And, the doctor and the nurses are going to treat me with a little bit more care and I'm going to feel supported. So it's,
Yeah,
there's a psychological element that isn't often addressed, and we talk a lot about that in the doula training. It's like kind of
yeah.
owning where you're still needing mommy and daddy to come in and support you,
Mhm.
make you feel
Yeah,
good, and how we replace our midwives and our doctors, with that. Expect them to
yeah,
do it, and they're not. They're really not, and that's why women feel dropped. So my doctor didn't show up for me. The nurses were horrible. I said, what were you expecting from them? They're there to just
right.
keep you alive. They're not there to fulfill that wounding that you have to heal. You know.
Right. Well, that's an interesting thought. I hadn't quite articulated it that way in my mind, where we identify with our condition so that we feel like we deserve the care that we're craving. So if
Yeah.
I'm sick being pregnant, then I get to have extra doting and attention and eyes on me. That's so interesting because I don't want that. And I don't know if other women want that too, but again, like that's part of the healing journey is like us doing our own internal work so that we can get to a point of like that internal sovereignty of like no, like I am capable of having this experience separate from needing other people. And my midwife and I had that experience, had that conversation of like she's there to make sure that baby's good, I'm good, no hemorrhaging, check box the box, I'm alive, but she's not doing any of the other things. Like that's my job and my husband's job. And I
Right.
appreciate that and like have that clear conversation ahead of time so expectations are met and there's no like
Mhm.
unspoken agenda, if you will.
Right. Yeah. Yeah, that
So,
self-holding is something that we all have to work on to some degree, in the process of our maturation and coming into adulthood.
yeah, whether it's a birthing process or other illness or the grief of loss of a family member that you were so close with, it's like
Right.
we have to sit in that discomfort. So again, we're back to like pain and sensation has a purpose, and we're so
Yes.
numb as a culture that we don't want to even feel it. And like, no, I don't love stubbing my toe, but it's a reminder that I need to be more mindful when I'm coming around the corner, right?
Well, yeah, I mean, I always tell my students how we birth is how we live, right? And we are in a
Mhm.
culture where we don't want to feel. So our rejection of feeling discomfort or pain is equally connected to our lack of capacity to feel pleasure. That's why so many people are looking for pleasure everywhere in all of these like voided, these places that are just a void, right? Pornography, substance,
Yeah,
technology. It's like I want to feel pleasure, but you're not going to feel pleasure until you can expand your capacity to feel discomfort, to sit in the
right.
discomfort. And so then women often opt out of feeling any sensations in labor or birth because they have no capacity to feel discomfort, which is
Wow,
also, like I said, totally an indicator to me that they have no capacity to feel pleasure. Where you ask the woman, like,
right.
"Are you happy? Do you feel good? Do you orgasm regularly?" Right? Like, what are the things that they? And a lot of them say no. Well, I don't feel
Mm,
good. I'm
yeah,
on antidepressants. I feel
yeah,
like something is missing. I don't have a
yeah,
relationship with my mother. I don't feel pleasure during intercourse with my husband. It's like all these things start to come out. So it's very clear to me that we are numbed out because we are traumatized collectively for our own reasons and have
yeah.
not dealt with it.
Right. That's so interesting, and I just wanna reiterate what you said because it's profound. how we birth is how we live our life. If we numb ourselves to the nth degree, and we all, we all have our vices, whatever they are, hopefully, as we mature, that we realize like, hey, like it's actually okay to feel and like be sad and cry yourself to sleep. And then the next day, it's great. Like I feel a lot better because I allowed that emotion to move through me and move instead of get stagnant and me just like smoking cigs or like drinking myself to sleep, right? To numb that sensation. And, something that was shocking to me because I'm about 5 years into my private practice, I had no idea how many women in their like 40s, 50s, 60s had never had an orgasm. I was like, what? It's a common
Mhm.
thing I have a conversation with my middle-aged women
Yeah.
about. And I'm like, that's
Yeah.
surprising. It was surprising to me because it's not something we explicitly discussed in my like women's health courses. And
No.
it sounds like you see this quite a bit as well in your practice.
Yeah, absolutely. And because we have so much charge around the word pleasure, there's like when we say,
Mm,
"Oh, I'd like to feel pleasure," so much comes up, right? Shame,
right.
guilt, selfishness. How could
Mm,
you? How could you prioritize pleasure? You have to take care of all your responsibilities before you can feel good, right? That's the way that we approach pleasure, or it's taboo because we can only associate pleasure with uh, these kind of like I don't know, hidden things, right? Things
sure.
that we're not supposed to know about. But it's like, how do you? I help my a lot of my doula students. Their marriages and their relationships start to shift as they go through the training because one of the things we look at is upping our pleasure. They'll say, I don't even know what that means. And I'm like, okay, here's an example. When you're cooking in the kitchen, right? Your child is playing off to the side, having the time of their life. Your husband comes home from work and he just goes showers and he gets on the couch and he checks out and watches TV, and you're looking around at everybody so bitter and resentful because look at you having to work, having to cook, and everybody else just gets to go relax. So
Yeah.
why is it that you've decided to create your own prison and say, I can't feel good right now? So how do you up your pleasure by 5%? What does that
Mm,
mean? Okay, if you're stirring the sauce and you're feeling miserable, what can you do to up the pleasure by 5%? Pause everything, go put on an outfit that's not your raggedy sweat, change your
right.
hair, right? Put on a dress, change your hair, and put on some music or a podcast and put on really fuzzy, delicious socks or slippers. Has your pleasure been upped just a little bit? Yes. Okay. Can everybody else be in their experience without you resenting them? Yes. So
Yeah.
it's like we want to believe that everyone is having a good time and we're not allowed to. But this self-punishment
Mm,
is something we learned so early on, you know, like you can't have this until you do this, right? That's how we raise our children. You can't
right.
have your
Right.
dessert until you have your meat or whatever. And so we grow up in the like, I have to self flagellate until I do the things. And then even when I get the thing that feels good, I don't even know how to hold it in my body. Don't even know how to
Mm,
hold pleasure in my body, right?
right.
So it's much deeper, right, than just learning how to use a yoni egg and enhancing your sexual practice. It is so much deeper than that. Some people say, "Oh, I'm trying to feel more in my pelvic floor. Should I get yoni eggs?" And I'm like, skip that because we need to get to the core of why you believe you're not worthy of feeling good, and then we can start actually working with the body a little bit more.
Yeah. I like that like functional piece though that you mentioned about when you're cooking in the kitchen and your partner gets home, your kids are playing and you're, quote unquote working, which is always something that's hard for me because I love cooking. I get a lot of joy out of it, especially if I get to cook for other people and they get to share food with me. One of the things I like to do is like if I'm having kind of a crap day is, can I just smile? Can I just turn the frown upside down? And the sweatpants thing, that was something I learned during COVID. Like you can't wear sweatpants every day. You just can't do it. You're not going to feel good. I'm not getting dressed up for anybody else except for my own damn self at that
That's
point.
right. That's right.
And you know what? It's worth it because it helped me feel better. And like these are simple, very functional things that you can do and you don't have to spend money on. Like yeah, I guess if you want to go get a mani-pedi or something and or get your hair done, but like you can throw it up in a different way than you usually do. Like these are very simple things to increase your pleasure. And why are you doing it? For yourself.
Mhm,
It doesn't have to be
mhm.
for anybody else. Like that's
It's
something
just
that's
it's just a keen self-awareness, right?
yeah.
Like you're why is my breathing restricted while I'm stirring the sauce in the kitchen? Oh, because I've been wearing a bra all day. Why am I wearing a bra? Like, what are the things how can I take this off? How can I do this? How can I let my hair down? Whatever it is to just feel that much more pleasure in the body. And
Totally.
this is not something I knew how to do my whole life. Like 5 years ago, when I started learning how to do this, I wouldn't even allow myself to take a nap in the middle of the day because that type of pleasure is incredibly selfish when there's things to do. I had to
Mm,
start by slowly allowing myself to disconnect. So I'd say, well, I can't go take a 30-minute nap at 2 p.m., but what I can do is close the computer and lean back in my chair for 10 minutes and
yeah.
breathe. So I had to
Yeah.
titrate. After like 2 weeks of doing that, I would leave the desk and go lie down. I wouldn't sleep, but I'd just lie down and say, "Oh, this feels great." And then I finally got to a point of taking a nap, right? And
Mhm.
then I got to the point of sitting outside in direct sunlight for 45 minutes. So it's like I had to build up to that. You can't just say, "You know what? Forget it all. I'm leaving the desk. I'm going to go for a joyride." It's like
Right.
titrate, let your system integrate it, but know that this is what actually makes you more enhanced and you do a better job at what you're doing. You feel more fulfilled. You're expanding your capacity to hold pleasure, which will
Mm,
then help you expand your capacity to hold the discomfort. And this is one of the practices that women have to start engaging in, preparing for their labor. Also preparing
mm,
for child rearing, right? There's going to be a lot of uncomfortable moments where your child is reflecting back to you where you still haven't healed. You have to be able to hold that in your body and say, "Okay, I'm accountable." Yep,
yeah. And
you
kids
know?
are the best damn mirrors, I tell you what, because that's one of the things I do really appreciate kids. I work with kids in my practice, is they have no filter, and I love that. I
Yeah,
hope that we can continue to have more, later on into life, and we're not shutting them down, after they're 8 years old and they're like, "Mommy, why is that person blah, blah, blah?" Like, just making the obvious
yeah,
observation that we all are thinking, but we don't say out loud, right? And I
that's right.
appreciate that about kids.
Totally.
And there's
It's
definitely
beautiful.
some zingers they do too. I'm like, "Whew, all right."
Yeah, yeah, and
Mhm.
then the adults who can't hold that in their body are the ones that'll lash back. They'll
Totally.
say, "Don't say that." They'll even, physical abuse, "Go to your room. How dare you speak like that?" And the child is simply expressing curiosity and
Yeah.
learning limits, they're learning, right? But the adult who got smacked for speaking up is gonna become the adult who can't hold that in their body, and they'll say, "I know I wanna be a conscious parent, but I also can't hold this, so I'm just gonna send them to their room because I can't deal with the discomfort of my child expressing themselves." So
Yeah.
it's a boot camp. It's a boot camp, and this is where a lot of my clients get the opportunity to heal that wounding from
Mm.
childhood, right? The
Oh,
emotionally unavailable parent, they could never hold your feelings, and so now we learn, "Okay, you're crying. I'm not gonna send you to your room and tell you to come out when you've calmed down," right? Feel your
yeah.
feelings. Feel them,
Yeah.
let them go, right? And this is how so much disease happens is that we suppress all of these expressions, and then we're wondering, why I have GI issues, why all these things. It's because you've never had the opportunity to have somebody properly hold you in your emotions. And so we learn to do that for ourselves through our
Yeah.
children.
Yeah. Oh, that's beautiful, and given that space again, and yeah, I one of the things I do appreciate about being younger, and I used to when I was in my teens and 20s, I was like, God, I was born in the wrong era, but I don't believe that anymore, because we actually now have language and verbiage to understand why sending your kid to the room after you just, chastise them for X, Y, and Z and let them cry by themselves is
Mm.
not actually that helpful, because you've just told them that crying and having an emotion is bad and negative, and don't do that. And then
Yeah,
then
and
what
that
do we
you'll
do?
only love them when they're good.
Exactly, that too. Well, and then there's, like, the whole, like, mommy wine culture thing. It's like, "Oh, it's so hard taking care of my kid, like, I guess it's 5 o'clock somewhere, I can start drinking now because it's so hard to deal with my kid." It's like, that
Right.
feels like such a shame, and I don't wanna I'm not trying to shame women that have chosen to do that. It feels like a shame, though, because it's missing out on the opportunity for growth on my end, but also growth to raise up a healthy, well-adjusted kid that, moves into the world and isn't abusive to their spouse or partner, and is able to, like, stand in relationship with others and be able to, reflect back and maybe help other people grow too. And it's the ripple effect. Can we think about not just today, but future generations as well, and the impact that we're having?
Well, yeah, I mean, it isn't about shaming, but it's also why the question, why would we have children only to give them the same treatment masked with a different costume?
Right.
You
Right.
know, the
Right.
same treatment
Exactly.
we got masked with a different costume. So yeah, it's just it's if we don't want to do that self-awareness, if we don't want to have things reflected back to us, then, having children is going to be very challenging.
Yeah, it definitely will be. And I used to think that breaking the cycle meant not having children. And at some
Mhm.
point in the last maybe 5 or 6 years, I've kind of shifted that mindset, because it's like, well, no, then that's me avoiding dealing with the crap and like doing a better job than my parents did.
Right.
And,
Right. Absolutely.
challenging myself in that way to grow and become someone who can hold space for a kid and not just want to, one of the asshole things I say is like sometimes there's kids that you just want to throw out the window. It's like
Yeah.
they just need that space, and like I say it crassly and not actually truly that's how I feel, but we've all been in spaces with kids that are just like, "Oh my god."
Well, those obnoxious behaviors that
Yeah.
are they're truthfully obnoxious come because there is an unmet need
Exactly.
in
They
the
need that
child.
attention in some way. Exactly.
And so what do we expect when we like, douse them with, dopamine hits constantly by giving them a screen and then taking it away and expecting them to behave properly? They
Yeah.
have needs that are just being suppressed with a device and with, a whole host of foods that make them completely confused about their environment and their bodies. And so then we expect them to behave and march a certain way. And when they
Yeah.
don't, we take away love. So I'm not really sure what people are doing. And I know a lot of us don't have a blueprint for
No.
healthy parenting and healthy family dynamics, and that's okay. But breaking the cycle is doing the work to learn that and make it productive and connected for the
Exactly.
child.
Exactly. And what we're talking about is like challenging cultural assumptions that if this is the way it's been, does it always need to be this way? And I don't
Right.
think so. And I don't really think American culture is the healthiest. Like we've gotten so convenient. We numb our
Yeah.
discomforts. You know, we're not comfortable being uncomfortable even for 5 freaking minutes. It's
Yeah.
like conflict avoiding. I want to challenge those assumptions because I do believe that we can get to a place where our culture is a bit more healthy and more, long-term sustainable for the human population. And right now, the
Yeah.
way we've been doing things, feeding our kids ultra-processed foods, antibiotics every time they get a sore throat, just suppressing symptoms, suppressing emotions. We're just in a culture of suppression no matter what the damn thing is. Suppress it.
Yeah. Right.
We don't like it.
Exactly. And suppress birth. I mean, it's just the
Suppressed birth, that's literally what an epidural sort of does, and it's like takes that power away, and it's like, I don't need to do anything except go to my OB-GYN appointments and show up when I'm starting to have labor and contractions, and, you know, yeah, it's
they'll
so
take care of
interesting to,
it.
like,
It's
track
the
it.
mentality. They'll take care of it. I'll show up
I
and
don't
they'll take care of it. And then
They'll
women
take
feel
care.
traumatized. So I ask women very often, there have been maybe a handful over the last decade where I've said, how was the epidural experience? It was fine, just
Yeah,
not a lot to say about it. But most women, let's say 95% of women that I talk to, they'll say, oh, you have to get the epidural. So, oh, you got yours? Yes. Did it work? I don't know. Would you birth again? Oh God, I really don't want to. It was a horrible experience. So if it was so horrible, why are we promoting this thing to suppress the experience if it didn't actually get you the results that you were hoping? Right.
yeah,
But it's like it's the norm. Your sister did it or your best friend did it. And so why would you do it any differently? You're just gonna do what the other women around you are doing. So to step out of that and maybe make a different choice and say, okay, I'll still go to the hospital, but it will be unmedicated and I'll take a birth class. That's a big step. It's not about saying, okay, I'm empowered, I'm going to go birth in the woods. Where can you meet yourself so that
yeah,
you're just one step closer to feeling more self-sovereign. You're one step closer to taking accountability for your experience right? Is there a birth center? If you're even considering doing things alternatively, just go visit with a midwife, even if you've already hired a doctor. Just see what it feels like to be in the space with someone else who can offer you different type of care, a different type of holding. If you're scared of what could happen, ask yourself, what am I actually scared of? What is the thing that I keep saying that could happen? Do I even know what those things are? Or is it just as existential fear of death?
Right.
you know? So
Right.
just allow yourself the opportunity to know your options. Because if you don't know your options, you don't have any options, right? So
Right.
this might be the only time you give birth. Why not expand into more possibility?
Totally. And one of the things I really love about your approach is because it's similar to my approach. It's like if we can do these incremental changes, we don't have to exactly go from birthing in a hospital to the next kid's being birthed on the ground under a full moon, like outside in the
Right.
dirt. Like that's not what we're saying, but like that 5% more pleasure, that 5%. Can you go visit a certified nurse midwife? They're actually nurses that are midwives that have hospital privileges. So they're still trained very much in the conventional approach, but you're going to find that a midwife has a little more space holding capacity. Not always. There are some fantastic OB-GYNs out there. Like, don't get me wrong. But it's like, can we have these conversations? Can we start exploring our boundaries just a tiny bit? And challenge these assumptions. And I'll tell you, pretty much all my friends that have had epidurals have had something not enjoyable to say about it. And like the whole one leg thing is a common thing I hear. Is like, yeah, one leg was numb and the other leg I was still having shooting sharp pain. And I'm like, I'd rather just have it equally distributed in my
Yeah, and
brain.
the problem with that is that now your body wants to get up and walk around, but you can't leave your bed,
Right.
even if you can still feel one leg. And so,
Right.
informed consent is the biggest thing here. If you are subscribing to any kind of procedure, intervention, even an IV, understand what the risks are, because even IVs have risks.
They
They
do.
cause edema, they cause labor to slow, they can cause a lot of complications. So things that might seem benign just because they're part of the rigmarole of the whole birth setting in the hospital doesn't mean that they don't come without consequence. So
Yeah.
as I tell my students and my trainees, it's not about polarizing women into a space of right or wrong. It's
No.
actually just about understanding the consequence, right?
Yeah.
If you want to breastfeed, there's going to be a lot of steps to take to avoid certain interventions so that you can get to the breastfeeding stage successfully, but you have to know what that is. So understanding consequences is the most important thing.
Yeah, pros and cons. There's pros and cons to everything. And sometimes we do need intervention and we're glad that it's there, but we mostly don't, I don't even say mostly, oftentimes we don't need the interventions that we're being given. And it's the standard of care, the rigmarole. Well, that's just how everybody does it. And again, can we challenge cultural assumptions that that's the way it's been done? So that's the way it needs to be done. And this is not traditional birthing practices. And I know
Right.
that in countries that don't have access to the technology that we do in the developed world, they have poor maternal fetal outcomes. But I'm also curious about that from the perspective of socially understanding that those cultures tend to be a lot happier than all cultures do. So they have a better understanding of sitting with discomfort and being able to allow themselves to have pleasure then, if that's the case. Like Bangladesh, I believe, is one of the poorest countries in the world. And they're also the happiest country in the world. Very curious to me.
Yeah, absolutely. And the thing about that is that these outcomes that we're talking about often come from lack of nutrition and lack of
Mhm.
postpartum support. It's not because
Mhm.
women gave birth outside of technology. It's not because
Right.
women in these countries were giving birth in a place that didn't have the latest, fetal heart monitor. It's because they live in conditions that don't set them up for easy birthing. So we
Right.
have so many resources in North America, for example, to be able to eat well, to be able to move, to exercise. There's a lot of luxuries that we have that can really maximize our outcomes, but we don't do them.
Absolutely.
And then we rely on the technology and, the cycle repeats.
Yeah.
So it's not because birth itself is inherently dangerous. It's simply because we've either ignored a lot of the time tested tools
Mhm.
or we are electing to do things that actually interfere with the natural birthing process.
Yeah, being in right order with, and while an ultra processed food may taste really good, and like, you don't always want to eat what you need to eat for pregnancy. It's necessary that we make those choices so that our birth outcomes are, we're setting our future self up for success. And yeah, in right order, being with our natural self. And unfortunately, humans are not ultra processed. We are of this earth. And as much as like Cheerios and Cocoa Puffs may be the thing that you want, like, is there something a little more nutrient dense that we have access? We have access to literally everything in the United
I mean,
States if we
even if
want.
you don't have access
Mhm.
to, people say, well, I can't afford, pasture raised, organic, you know, grass finished meat,
Right.
that's fine. Then eat whatever you can afford, but you need to eat meat
You need to
because
eat meat. I
I
agree.
I'm not a dietitian, right? And I don't have that background, but I've been doing this long enough and I've worked with enough dietitians who understand that we can only get what we need through animal-based products. And this is why I've seen so many of my clients who are vegetarian-based or vegan have spontaneous miscarriages, have low birth weights, have preterm labor.
Yeah.
It's not to say that you can't be vegetarian and come out unscathed. However, you increase your risk of poorer outcomes.
Yeah.
And so if philosophically, spiritually, a lot of people make these choices. However, it's not actually, there's never been a society that has been primarily plant-based and has survived. So,
Amen to that.
this is where making a quote sacrifice, let's say, or a change for the sake of the pregnancy and the birth and the breastfeeding journey would benefit the mother. This is part of being the mother, is giving the things so that the outcomes and the family are improved, right?
Yeah.
um, and putting these personal things aside, it's part of what has to happen. But if we dig our heels in and say no, I'm not going to do that, then we're not going to have the benefit
No.
that we could be having.
Any final things you want to say about your doula training that's coming up in January of 2025?
Yeah, yeah. So I love this doula training. I've been doing it now for 4 years, and it happened because I did a doula training that was quite conventional a little over 10 years ago, and I felt like so much was missing. And I started to come into contact with a lot of doulas who feel like just could have offered so much more, and they didn't have the what I would say is the more emotional intelligence to support women in this
Mhm.
process. So I designed this to help women, support them in cultivating that emotional intelligence and the emotional awareness, while also learning about birth, while also learning about the system, and taking themselves out of these polarized places. Like, we're not on a crusade here. We're just about helping women remember what they already know.
Mm.
And so this is, my pride and joy is really this program, because women come out personally transformed and then they go out into their community and start to create that ripple effect. When women
Yeah.
feel self-sovereign, they feel more freedom, they feel happier, and they can be better mothers. And so this is really how we're just slowly, shifting the cultural fabric of society. It's by women becoming more fulfilled. They become better wives, they become better mothers, they become better selves, you know.
Yeah.
So I love the doula training, and everyone is welcome to apply. If you've never given birth, if you are at a juncture where you're a massage therapist, but now you're realizing you want to do something a little bit different and you want to go into this realm, everybody's welcome. I've had acupuncturists come into the training. I've had chiropractors come into the training. It's really for everybody.
That's awesome. And again, that ripple effect, when we take care of ourselves, it has a ripple effect on all of our relationships, our community.
Yeah.
So we talked about quite a few different things. We talked about what a doula is. We talked about some of the birth interventions and that they do have some consequences in a hospital setting. And, informed consent isn't always given when we're in a hospital. It's up to us, the person that's having the birth, to go in and get that get that understanding. Like, that's us, radical self-responsibility. And we also talked about this thing in our culture where we don't really want to feel any amount of discomfort. So every time we feel uncomfortable, we numb it with something. And that blunts our sense to be able to feel pleasure as well. And pleasure can be a trigger word. And we have some things that we need to do to unpack so we can start healing that relationship. And can we just incrementally start to increase our own pleasure, whether that's, putting your favorite song on while you're cooking in the kitchen. It's like we don't have to have a negative experience because we're doing something while the rest of our family is, quote unquote, enjoying themselves. Like, can you bring
Right.
joy? Um, and
Yeah.
then we also need to ask this question: what does safety mean to you? Because if safety means to you just not dying, well, great. Then the hospital is probably a good place for you. But if safety means other components like emotional and spiritual safety, maybe it's worth exploring some other options. And there are lots of options. And this is why having someone like a doula can be really valuable, because they can help guide us in this, especially if you're a first time parent, guide us in this experience and say, hey, do you know about X, Y, and Z? It's like, oh man, I had no idea about that. And kind of just give us that like foot through the door. And yeah, we talked about this. How we birth is how we live. So if we are going to numb our experience, and again, there's no right and wrong. It's just like I want to challenge cultural expectations and cultural assumptions. And I think this conversation brought a lot of that to the forefront, especially with the way we birth in this country.
Yeah.
Eyla, where can people find you if they want to get in touch with you, if they want to, if they're considering your doula program, where can they find more information?
Yeah, uncoveringbirth.com is where everything is at. We have all kinds of classes on miscarriage, fertility after the age 35. We have the doula training. We have the birth educator training. We have one-on-one sessions. We're cultivating some offerings for men as well at the
Cool.
moment. So yeah, I'm there. And then I'm also on Instagram.
Instagram, yep. And I've got your handle. I'll stick that in the show notes. And I really appreciate you coming on today. Our
Yeah.
next guest is a colleague of mine and a mentor of mine, Dr. Christy Fleetwood, who was a pharmacist prior to becoming a naturopathic doctor. And she is a pistol. And so we're going to talk about some of these consequences of medications that, don't seem to really get brought up when you just get prescribed an antidepressant in your office when you go in for a postpartum 6-week checkup with your doctor. So there are side effects, and these are things that are well known and established in the data. And so it's going to be a fun conversation for her and I to have. And if you found this valuable, interesting, controversial, like and subscribe, share it with someone that might have a different opinion. I'm always looking to have those respectful discourse conversations so that I can grow and learn, so that we can grow and learn, so we can have a conversation around, can we change the culture that we're having currently, or the experience that we're having? Thank you so much, and we'll see you next time.